at the end. I'm going to introduce our next speaker, Dr. Jun. So she's also a foundation doctor year 1. She graduated from Glasgow, the University of Glasgow, and she is on a different sort of foundation program. She's in the academic foundation program, or the specialized foundation program, now it's called. And she has a lot of experience with research as well. She has an interest in cardiology, and she does also widening participation work to help us paramedical students. So she's the perfect person to talk to you about her adaptation to the NHS system and how she found it, and really share her perspective and best tips to help you guys adapting to the NHS system as well and other career pathways. So welcome, Dr. Jun.
Thank you so much. Can you see my slides okay?
Yeah, we can.
Okay, thank you so much for inviting me to this. It's really a pleasure to speak. So my talk is about understanding the NHS system in Scotland, and hopefully it won't be too long, it'll be about 20 minutes. So let's take you through this one by one. So firstly, I promise F1 is a lot better than the horror stories that you hear about, but at the same time, try to enjoy medical school while you're there and enjoy the freedom that it provides. So a bit about me. I was born in Belfast in Northern Ireland. I was very lucky to go to University of Glasgow for my medical school studies. It was joint top UK Medical School Dundee last year in the Complete University Guide 2021, actually this year. I did a 6-year degree, including a BSc in clinical medicine, specialising in cardiovascular studies. During my time on clinical placement, I spent most of my time at the Super Hospital, which is that bit on the top left, and that's called the Queen Elizabeth University Hospital in Glasgow. I also spent a considerable amount of time in Ayr Hospital, which is sort of like south-west Scotland, I'd say. So in final year, the F1 applications came around in October time, which is quite quick. So it's good to prepare well in advance if you're looking to apply for one of the specialty programs. I wanted to change the scenery. I also wanted a chance to explore London. So I applied for the AAP in London and was really lucky to get a place. So at the moment, I'm in the place on the bottom right picture, which is Northwick Park Hospital. It doesn't look amazing, but inside it's great. So that's me in F1 now on general surgery, and I'm going to be rotating through endocrine and respiratory medicine afterwards. And then next year, I'm going to be going to Charing Cross Hospital, which is a more sort of central teaching hospital in London. So in terms of stuff I'll be talking about today, I'll be talking about the levels of care, medical school to training, and also the NHS pros and cons. So first, levels of care. So the NHS Scotland was founded in 1948, which is the same time that the NHS England was founded. And it's got just under 150,000 employees, split into about 5,000 consultants, 5,000 GPs, almost 70,000 nurses, midwives, health visitors, some nurses, some pharmacists, plus many, many more staff. How it's divided is a bit complex, so I'll try to take it step by step. It's also like not the most exciting thing ever, but it's good to have an idea about how the NHS system works. So it's split into many planning levels, so quite a lot actually, so we'll go bit by bit. So initially you've got your national planning, which is like organised or managed by the Scottish Government and 8 national health boards, so it's sort of done on like a once for Scotland basis. Then underneath, you've got your regional planning. So you've got your regions in North, West and the East, and they sort of focus on the more specialist services and try and focus on delivering the quickest care to people to provide less delays for the emergency portion of care. Then you've got the NHS boards, which is what we're all quite familiar with. So I was part of NHS Greater Glasgow and Clyde, there are 14 of them altogether, and they provide the acute services to the population. Next, we've got something called the Community Planning Partnerships. There are 32 of these, and they sort of have a focus on tackling outcomes and sort of tackling inequalities as well. And they identify smaller areas and try and work on improving those areas with like poor outcomes. Afterwards, you've got something called integration authorities. There are 31 of these, and they are in charge of a range of health services such as primary care and some social care as well. And they would usually be members of the CPPs above. And then finally, you've got your localities. So they sort of plan resources and how they are distributed amongst the population. Okay, so next we'll talk about the levels of care. So you've got primary care, secondary care, and tertiary care. In terms of primary care, and this is your general first point of call, which I'm sure you're aware of, you've got your GPs. So in terms of GPs, you've got GP partners where they sort of have a business element to their practice. So they usually own all or like a part of the practice. You've also got salaried GPs. So they're GPs that come in to maybe work for a year, but they don't own the practice. They just get paid for practicing at that GP. And you also have GPs that are employed by the health board, especially in like rural areas in Scotland, like up in the Highlands and things like that. So you also have dentists as well in primary care. In Scotland, it's quite unique because for dentistry, but up to 80% of your treatment can be funded by the NHS. So it's quite rare for those people who are able to afford to go private. And also you get some things under the NHS, such as like prescription glasses, like specific ones as well. And usually in dentists in Scotland, you've got like a mixture of like private and NHS patients. You've also got your community pharmacists. So in Scotland, the medications or the prescriptions that you get are actually free, which is really good. You don't have to pay like a standard fee of, I think it's like £7 in England. So that's really nice. And also the community pharmacists have more responsibility. They're involved in like flu vaccination programs, and they also give advice on like skin issues and like small minor illnesses as well. You've also got optometrists. Your eye examinations and screenings are free in Scotland. So things such as like your retinal health checks. So that's quite cool as well. So next, we've got secondary care. So this is mainly like hospital-based care. So you've got your 14 NHS health boards that I'll talk about afterwards. And you've also got your 7 special health boards, and you've got your 1 public health body. So in terms of the 7 special health boards, you've got Healthcare Improvement Scotland, so that they support the delivery of really high quality care, and they also look at evidence-based medicine as well. You've got your NHS Education for Scotland, so that's just supporting education. You've got your NHS Waiting Times Centre, so they make sure that you get like prompt first-class treatment as soon as possible. You've got NHS 24, which is like the phone line where you get really quick telephone advice for any issues, and they also signpost you to the hospital if they think your illness is severe enough. You've got your Scottish Ambulance Service, so they respond to many emergency calls throughout the year, and they also are responsible for taking you to hospital in an ambulance should you get unwell. You've got your State Hospitals Board for Scotland. So I think they manage Carstairs, which is one of the national hospitals for psychiatry. So they provide assessment, treatment, and care for conditions of people with special security measures because of any like dangerous past. And then finally, you've got your NHS National Services Scotland. They provide essential services such as health protection and blood transfusion. And then you've got your public health body, which is the thing at the bottom of the secondary care paragraph bit. And they're just a national leading agency for public health. Okay, and then finally tertiary care. So they're very specialised centres that you would be referred to from usually your secondary care hospitals. So you've got your Beatson Oncology Centre in Glasgow, which is beside Gartnavel or in the Gartnavel campus. And you've also got your Scottish Liver Transplant Unit in Edinburgh, which took care of all the liver transplantations. Okay, so these are just pictures of the regional health boards. So there are 14 of them on the left-hand side. And then they are placed all around Scotland. You can see the NHS Highlands, quite a huge one because it's such like a vast population with not much, like not very large population. Okay, so on to medical school to training. So they are, as the previous speaker I mentioned before, Eliana, and there are 5 medical schools in Scotland. So here are them listed, and they're quite spread around like the central of Scotland. Okay. And then in terms of applications for F1, so this usually happens in your final year of medical school. So it comes around quite quickly. I think this year the application deadline was like in September time. So it's quite quick. And so it's good to spend a good bit of time preparing before this. So it includes the applications for all of these programs, your foundation program, your specialist foundation program, also known as AFP, and your foundation priority program and the psychiatry foundation fellowship. So this timeline that I'll show you next is sort of based on the foundation program that's starting next year. So it's just an estimate. So usually what happens in September is that the application window opens, so you can start applying then. And you also apply for your reasonable adjustment for SJT. That's something that you get. So the SJT is that sort of situational judgment test that you need to take in order to enter F1. If you're doing the foundation program or the foundation priority program or the psychiatry foundation fellowship, you don't actually need it for the SFP or AFP, which is quite good. After this, so you actually book your SJT in about October time. And this is also when your university releases the educational, I think A stands for attainment scores. And so I think that's your decile scores at about mid-October time. Then the first window of the SJT, so whenever you can actually sit your SJT test, takes place in December. So that's the first one. And then you've got your deadline to amend your preferences if you're applying for the specialised foundation programme in sort of the early January time. And then the second SJT window is in sort of like the middle or beginning of January. And then you've also got another deadline to amend your foundation programme or foundation priority programme in the middle of February. And then deanery allocations come out in March time. And this is whenever you will be allocated your deanery. So for example, Scotland is one entire deanery. So then after you get allocated Scotland, if you choose to go to Scotland, then you pick like groups. So whether you're like based in North, East, West, or I think South, they're split into different areas. And then within that, you'll then pick your programs, so your specific programs that you'd like to go to placement or go be a doctor in. And then you've got match day in April. So that's whenever you get your final program. And then finally in May time, they will give out the places for reserve lists. They also do some like pre-work checks. So starting work in August. And also you'll do your provisional GMC registration then as well. Okay, so in terms of the overview of specialty training in the UK, it's quite complex, but I'll take you through it step by step. So first you've got 2 years of foundation program, which is what everyone in the UK does. So you've got your FY1 and FY2. And like usually these programs are quite general. So you have a mixture of like medicine, surgery, and like community placements, such as like GP and psychiatry, things like that. Then after your F2, many people choose to take an F3 year out, so they can do that to maybe do more work, like you can work as a locum, or you can travel, or you can spend time to take maybe an extra degree, or do other stuff to like build your portfolio, and also explore different interests outside of medicine, which is always really exciting, because it feels like medicine can be like a very, very long journey if you don't take a break. Then after that, you'll apply for your core training posts. So there are different types of core training posts, but the main types can be split into the following. So you've got CST or core surgical training 1 and 2, usually like a 2-year program. And you've got IMT, which is the internal medicine training, which is a 3-year program. So you've got 1, 2, and 3. You've also got run-through programs, and you can find them in pediatrics, radiology, and some surgical specialties as well. So you'll do ST1, ST2, and then you go straight to ST like 7 or 8 or however long it is. So you don't have to reapply, which is really good. Then you've got GP ST1, 2, and 3. And that's if you want to go down the GP route. So you rotate through hospital placements, but you also spend time in the community as well. Then after this, if you're not on the run-through programs, then you apply for specialty training. So this is whenever you become like, you start training in your area of interest. So you can do specialty training in like cardiology, different types of surgery, and other different types of medicine as well. So it's quite a long training program, but you can rotate between hospitals. So it's good if you like to experience like different hospitals and stuff. Okay, and then after that, you've got your CCT, which is your certificate of completion of training. So that's after you've finished your ST years. And then after that, you'll then apply for consultancy jobs. Okay, and then I'll just talk briefly about academic training because that's something that I hope to pursue. In England, you've got the academic training managed by the NIHR. So that's the National Institute of Health Research, I'm pretty sure. So they are involved in managing all the academic trainees, and you can follow their program. I won't talk too much about that because I'm not too sure about it. I'm just mostly focusing on the Scottish program for today's talk. So in Scotland, it's quite similar, but it's called the SPREADS program. Broadly speaking, in terms of both of these academic training programs, your clinical training is relatively the same. So you still follow like foundation program, CT, and then like ST, and then you'll become a consultant by the end of the day. So the SCREVS program stands for Scottish Clinical Research Excellence Development Scheme, and it's sort of like a local Scottish-based recruitment. It's not like a national recruitment process like the AFP program. So you've got three broad programs that you can choose from. So you've got clinical lectureships. So these are usually appointed by universities. So you'll be a lecturer and you'll regularly lecture like medical students. You've also got out-of-program research. So this can be funded by universities and also large bodies. So you might have heard of large bodies such as the Wellcome Trust and the Medical Research Council and the British Heart Foundation, and also Chief Scientist in Scotland. So you can have programs such as being a clinical fellow or a clinical lecturer. And then finally, you've got your advanced academic career development. So you can do stuff before your certificate of completion of training, such as being a clinician scientist or doing some intermediate awards. We can do stuff after your certificate of completion of training. And then these are the two things you can do in terms of that. Okay, so in terms of the pros and cons of working in NHS Scotland, I have to say disclaimer first because I'm not actually doing my F1 in Scotland, but I did do my preparation for placement or preparation for practice placement in general surgery at the big hospital in Glasgow. I spent 5 weeks there, which was really exciting. And then I've also worked as a care assistant in the infectious diseases ward at the QEUH as well. So in terms of the pros, I think it's a really good idea to work in the NHS because you're caring for patients regardless of their background or money. So the NHS is free at the point of care. So that's always really nice to contribute to and like give back to society. Your colleagues becoming your friends. And my F1 colleagues, there are 2 of them rotating through general surgery with me at the moment. And we're really close and we laugh and we talk about difficult things together. And we like regularly support each other and regularly go to dinner together. And we look forward to going to dinner and like catching up after work, which is really nice. You've also got less than full-time work as well. So if you've got like specific circumstances, such as health reasons or like childcare or other sort of things, you can apply for working less than full-time. So that's a really good option as well, should you need it. You've also got time out of program. So you can take time away to do your interests, such as hobbies, sabbatical years, research opportunities as well. Yeah, in terms of research opportunities, you've got different projects you can get involved with while you're working as well and also outside of work. So there's many opportunities to do that and you just need to be proactive and try and find them. And there's also opportunities to teach medical students. So if you're very into teaching, you can also do this too. In terms of cons, it can be quite stressful. So the NHS is publicly funded. So it means that they're not really, the work schedules can be quite busy. And sometimes you can be quite understaffed. So that's something that we shouldn't really have to get used to, but in reality, sometimes it is the case. And it really depends on the hospital. Some hospitals are quite understaffed, but there are some that working is a bit better. So I really recommend talking to F1s in the jobs that you would like to work in, seeing how stressed out they are, like seeing what they enjoy about the job to see if that's where you can see yourself working as an F1. So the IT systems can be a bit of a pain as well. They're quite slow, often quite out of date. Sometimes you've got hand prescriptions instead of computer prescriptions, so that can take a lot of time and effort. You've also got a lot of protocols. So protocols are okay to follow, but sometimes it can be like finding, and that's the most difficult part. There's like certain search results you need to remember to be able to find a certain protocol that you need for like certain patients sometimes, which can be quite frustrating. And also organizing annual leave can be difficult, but it depends a lot on your rota coordinators. And I've been quite lucky with my coordinator at Northwick Park Hospital, but sometimes it can be quite difficult to get leave if you really want it for like, say, like a wedding or something like that. And you've got e-learning, which can be quite a pain because it can take quite a long time. But the good thing is you should be getting paid to do e-learning as it's part of your job. And also finally getting time for teaching. So teaching is mandatory as an F1. I think for London at least, you need 60 hours of teaching, and you need to record that to make sure you have evidence. So it can be quite difficult to get time for that. And if you're not very good at managing time, and if also your rota doesn't really allow for it, so that can be quite difficult as well. So I think that's mostly everything I'm talking about today. I think we're just reaching 20 minutes, which is good. I've kept the time. So thank you very much for listening. And I guess my most important bit of advice is to study hard, but make sure you make time for fun, because there's nothing worse than just living to do work. And that's all you do. So for example, on general surgery, I work 50-hour weeks, but I still make time for fun, see friends and like family and stuff like that. And this is what I've gone up to in the past 2 months already. So you can see probably I've had a bit too much fun. But it's really important just to take time out for yourself to make sure that you look after yourself as well. I've got a feedback link and where there aren't that many attendees, but if you would like to, feel free to fill it in. I'd be very grateful. But thank you very much for listening.
Amazing. Thank you, Dr. Jun. I think these were such amazing tips, especially about the academic foundation program, which is many people are very interested about. And I think it's great, especially if you're interested in medical education, research leadership. So I think the international students, they probably didn't hear about that before. And then this is something that you can look forward to throughout your medical career, because you can also preparing throughout medical school to apply to the academic foundation program later on. Thank you so much.